S. Trautmann, and I am the medical director of the South Carolina division of VIA Health Partners, which is a hospice organization formerly known as Hospice and Palliative Care at Charlotte. I retired from practice of oncology about 7 years ago, and I've been doing part-time hospice work since then. And generally, my work consists of reviewing information about new patients, hospital records and admission notes, making decisions about how the care could be modified as they enter hospice care, and then implementing those changes. Also, I take phone calls from the nurses who are in the field, the nurse practitioners and the nurses who are administering the minute-to-minute care for patients. If they have questions or need guidance, I'm available to assist them. So I finished my training in medical oncology and started practice in 1986. And at that time, hospice was just kind of getting off the ground in the Charlotte, North Carolina area. It wasn't brand new. It had been here for several years, but it was a very small organization. Maybe 1 or 2 nurses and 1 social worker was the entire size of the organization at that time. And they asked me if I would participate and assist them as a volunteer medical director. So I did that for a couple of years. And then later on, when I changed my practice to radiation oncology, I again became involved as a volunteer medical director. Around the late 1990s, however, the hospice organization began to grow, and it grew quite impressively to the point that they really needed a full-time medical director. The extent of my work and efforts prior to 2000 were as medical director, a volunteer role. When I retired from radiation oncology about 7 years ago, I didn't want to leave the practice of medicine completely, and I had always been interested in hospice care, and I was fortunate enough to find an organization where I could work part-time. It's just very gratifying work. There are no better healthcare workers than hospice nurses and hospice social workers, in my opinion. They're so outstanding, and any benefit or help or assistance that I can provide is a source of gratification for me. When I started practice of medical oncology in 1986, we had, as you might guess, a lot of patients who died of cancer. Cancer treatment was not terribly good back in those days. It has come a long way in the last decade or two. We used to admit patients to the hospital for end-of-life care, if you can imagine how archaic that is. Patients and families were not at all comfortable having their family member die at home. So on a typical day back then, I might have 5 or 10 patients in the hospital on a morphine drip for pain control with what was basically end-of-life care. And of course, the whole hospice philosophy has changed that situation dramatically. Now it is rare for a patient with a terminal illness to spend their final days in the hospital. They're able to spend it at home probably 90% of the time, and maybe 5 to 10% of patients require an inpatient unit in a hospice facility during their final days for comfort. So to me, that was just a much more humane way to take care of patients who were in the final stages of cancer or other terminal illness. Going the extra mile to me is easy because, again, the nurses and social workers that I'm kind of backing up are just incredible healthcare providers. The work that they do from minute to minute and day to day is truly amazing, and anything that I can do to help and support them is automatic in my view.